Norm Ornstein, a resident scholar at the American Enterprise Institute. There's at least a chance now that we're going to find a jolt in the Republican Party, losing the White House, losing seats in the Senate, deciding that they're not going to be able to repeal Obamacare, that instead of just trying to throw wrenches after wrenches into the works to keep it from being implemented, they're better off trying to make it work. And that will include, I think, a significant focus on the health IT. The downside, potential risk here is that as we move forward with more and more fiscal austerity, budget restraint, that we start to cut money out of everything. And that would include money for implementing the Affordable Care Act, and it includes cutting money out of the health IT world at just the point when it's clear we need a substantial increase in that infrastructure to make sure we can get communications occurring across the different platforms, which has been one of the real problems here. I think there are two things. One is you've got to be aware that we're dealing with an ever-changing, slippery environment where you have to be flexible. There are going to be a lot of changes in implementation of health policy. They're going to affect everybody, and we don't know quite how those will reverberate. But the second is this: there is a change. There's a chance now to create a different dialogue. You've got a lot of people out there suggesting that Obama has to think big. And thinking big can mean the best way for us to compete in the global economy is to have a massive movement for infrastructure, building the knowledge network. That's our great comparative advantage. We need to move forward not just with expanded broadband, with extraordinarily high speeds where we can, but we've got to move in areas like health IT to become the global leaders. And if we can get that message across, indicate that it doesn't just take a lot of federal money, that you can do it with private and public partnerships, but that it is an investment that will pay off big time in the future, I think you're going to find a receptive audience that goes beyond just the small group of people who are directly involved in health IT.